Hello everyone and welcome to today's session. I'm Miss Kanyambo from Grace Institution Center, and today we are going to look at something really interesting, and that is ectopic pregnancy. So many students, once they hear ectopic pregnancy, they tend to get scared because they think it's like a very complex condition. But if you stay with me through this session, through this lesson, I believe you're going to gain an insight that is actually going to help you go about this condition whenever you come across it. Yeah. So ectopic pregnancy is it's also known as, or commonly known as, tubal pregnancy. Tubal pregnancy is coming from the fact that the normal pregnancy is supposed to be implanted in the uterine cavity, but you find that in the case of ectopic pregnancy, the pregnancy or the embryo implants in another place where it's not supposed to be implanted, and then that is a condition that you're calling as ectopic pregnancy. And then you find that the most common site for an ectopic pregnancy is actually the fallopian tube. No wonder it's sometimes referred to as ectopic tubal pregnancy. Instead of ectopic pregnancy, you can actually come across it as tubal pregnancy, because many of the ectopic pregnancies actually, or the embryo, many implants in the fallopian tube in this case. So ectopic pregnancy or tubal pregnancy, it is caused when a fertilized egg lodges in a fallopian tube or other locations. Like I mentioned, for the fallopian tube is the common site. Instead of the fertilized egg continuing its journey to the uterus where it is supposed to be initially implanted, you find that it becomes stuck in the fallopian tube. You find that it gets stuck in the fallopian tube and it tends to implant in there. But what you need to know is that the ectopic pregnancy is different. Ectopic pregnancy is actually different from a molar pregnancy, because a molar pregnancy is a mass of tissue derived from an egg with incomplete genetic information, and then it tends to grow in the uterus in a mass like a grape-like mass, and then it can cause the same symptoms as those of the of the normal pregnancy. So you need to know ectopic pregnancy is actually different from molar pregnancy. So let's go ahead. So ectopic pregnancy presents a major health problem for women of childbearing age. It is a result of a flaw in human reproductive physiology that allows the conceptus to implant and mature outside the endometrial cavity. So the endometrial cavity, initially, this is what a normal pregnancy is supposed to implant. And then if the fertilized egg or the conceptus implants somewhere else, the resultant is an ectopic pregnancy. So it's a result. It is the result of a flaw in human reproductive physiology that allows the conceptants are to implant and mature outside the endometrial cavity, which ultimately ends in the death of the uterus, because you know the endometrial cavity or the uterus, it has been designed in a way that it can support the growth of the fetus. So you find that when it grows outside the endometrial cavity of the uterus, that place is not actually conducive for the development of the fetus, hence it cannot survive. The resultant will be death. Without timely diagnosis and treatment, ectopic pregnancy can become a life-threatening situation, both for the fetus and especially for the mother. Ectopic pregnancy derived from the Greek word ektopos, meaning out of place, and it refers to the implantation of a fertilized egg in a location outside the uterine cavity. Include the fallopian tubes. You can also find the cervix. It can also implant in the ovary, the corneal region of the uterus, or in the abdominal cavity, but this is a rare case. So this abdominal cavity, the implantation happening in the abdominal cavity, it's a rare case, but many of these ectopic pregnancies actually are commonly implanted in the fallopian tube. This abnormality implanted gestation grows and draws its blood supply from the site of abnormal implantation. As the gestation enlarges, it creates the potential for organ rupture, because only the uterine cavity is designed to expand and accommodate fetal development. You find that in these other places where this implantation has actually occurred, it is not conducive for the development of this fetus. So you find that many complications can actually occur. Ectopic pregnancy can lead to massive hemorrhage, infertility, even death. Now, which we'll look at and further. So how do you define ectopic pregnancy? An ectopic pregnancy is a gestation that implants outside of the endometrial cavity, or an ectopic pregnancy is an implantation of the fertilized ovum outside a normal uterine cavity, nearly always in the fallopian tube. No wonder it's also known as tubal pregnancy. And then ruptured ectopic pregnancy is when the growing embryo causes rupture of the fallopian tubes. So you find that an ectopic, somebody can, a woman of a childbearing age can come with an ectopic pregnancy. So in that condition, they can either present with a ruptured ectopic pregnancy or a non-ruptured ectopic pregnancy. And management will actually depend in what state this person has actually come in. Ruptured ectopic pregnancy is actually an emergent condition. And then some of the predisposing factors, when you look at the predisposing factors of ectopic pregnancy, anything that is going to impede the migration of the embryo to the endometrial cavity will actually predispose a woman to ectopic pregnancy. So some of these things that can actually impede the migration of an embryo to the endometrial cavity or predispose the woman to a person to ectopic pregnancy, we have pelvic inflammatory disease. So pelvic inflammatory disease, it's an infection of one or more of the upper reproductive organs, including the uterus, fallopian tubes, and ovaries. So if the PID is actually not treated, you find that it's going to cause scar tissue of these organs that we've actually mentioned and cause permanent damage. Because of the scar tissue in either the uterus, the ovary, you find that the migration of the embryo is going to be limited in some way. You find, therefore, it can get stuck along the way and implant there. And then also history of pre-ectopic pregnancy. So you find that this person, if a person who's got an ectopic pregnancy, you find that they've had it before as well. And tubal surgery such as tubal ligation and tubal reconstruction resulted in histological and structural damage that follows sperm passage. So I find that these procedures are actually very intensive procedures. Therefore, when they're done, you can find that they can actually cause damage to the organs. The tubal surgeries and tubal ligations, these are surgeries that are involving the fallopian tube, and these are very invasive procedures. Therefore, we find that during these procedures, the fallopian tube can actually become damaged, and that can limit or hinder the smooth migration of the embryo into the uterus rather. Endometriosis, it can also predispose somebody to ectopic pregnancy, and use of ovulation inducing agents. So endometriosis is a disorder in which the tissue that normally lines the uterus grows outside the uterus. And then we've got intrauterine devices that cause uterine environment and unconducive for embedment. So when it comes to IUD, which are intrauterine devices, they contain progesterone, which relaxes the muscles that assist in the movement of an ovary. So you find that for an ovary to move, muscles need to constrict and relax, but you find that the progesterone that is found in these intrauterine devices is actually relaxing these muscles. Hence, you find that the ovary will not be propelling accordingly, and it is going to limit its movement. In order for it to reach the uterus, for it to implant it there, it's going to be limited because the muscles assisting in its movement, they have relaxed. Yes, and then we've got surgical procedures for treatment of fallopian tubes. Fallopian tube disease may affect the structure of the fallopian tube, just like I mentioned on the tubal surgeries, such as the tubal ligations. They can actually damage the fallopian tube, hence predisposing a person to ectopic pregnancies. And then sites of ectopic pregnancy is actually very important. You can actually be asked to draw a very neat diagram that is actually highlighting the common sites where an ectopic pregnancy can actually implant. So most common pregnancies are located in the fallopian tube, just like I've been mentioning. The most common site is the ampullary portion of the tube, where over 80% occur. The next most common sites are the is Yes, so the next most common sites are the isthmic segment of the tube, which accounts for 12%, the fimbrial 5%, and the corneal and interstitial region of the tube, which accounts for 2%. The non-tubal sites of ectopic pregnancies are a rare occurrence, like I mentioned, which with abdominal pregnancies accounting for 1.4% of ectopic pregnancies, and ovarian and cervical sites accounting for 0.2% each. So these are actually highlighting the common sites where an ectopic pregnancy can actually implant. Same with this diagram and the other diagram, just for further highlightation. So the signs and symptoms of ectopic pregnancy. So the classic clinical triad of ectopic pregnancy is pain, amenorrhea. So there are three: pain, amenorrhea, which is the absence of monthly menstrual periods, and we have vaginal bleeding. So these three are the main classical symptoms of ectopic pregnancy. Then you may have the patient presenting with other symptoms common to early pregnancy, because remember, this person is actually pregnant, but the only abnormality we have here is that the implantation of this pregnancy is not where it's supposed to initially be, which is the uterus, but it's in another place. So they'll actually present with the common early signs and symptoms of pregnancy, which is nausea, breast fullness, fatigue, low abdominal pain, heavy cramping, shoulder, vaginal and recent dyspareunia, and vaginal bleeding, palpable. This is specific to ectopic pregnancy. We have vaginal bleeding, palpable adrenal mass, and abdominal tenderness. And then the signs and symptoms of ruptured ectopic pregnancy. So like I mentioned, the ectopic pregnancy can actually rupture, or so there is unruptured or ruptured ectopic pregnancy. This would depend with the condition in which the person is actually coming in with. So if the patient comes in with a ruptured ectopic pregnancy, you'll find that they're going to experience severe low abdominal pain due to the ruptured tube. There's going to be a rapid pulse and hypotension due to bleeding from the ruptured tube. So there's actually an intensive amount of blood that is, or an extensive hemorrhage. So there's going to be blood track up under the diaphragm. Therefore, it's going to give shoulder pain. There's going to be, the abdomen is going to be slightly distended, tender and rigid. On vaginal examination, the uterus is going to be soft. And then there'll also be signs and symptoms of shock, because like I said, there's extensive hemorrhage occurring here due to the rupture of the ectopic pregnancy. So there'll be signs and symptoms of shock, such as cold, clammy skin, restlessness, anxiety or confusion, as well as hypotension. And then when it comes to management, now we look at the investigations, history, physical examination, laboratory investigation, and the imaging studies. So history is going to show there may be history of pelvic inflammatory disease or tubal surgery. So if find the patient maybe they had a PID or they had the tubal surgery, because like we say, these can actually damage the fallopian tube, and therefore impedes the migration of the embryo or the fertilized egg. Or they can also have the history of one of the presenting symptoms such as low abdominal pain. So the room pregnant case is going to actually show positive, but when you do a ultrasound, you find that there is no intrauterine pregnancy, there is no implantation in the uterus. So this will start surfacing question like, okay, this patient has tested positive for pregnancy, but we can't see the pregnancy. Therefore, suggestions of ectopic pregnancy can actually begin to rise in order to give a diagnosis. So aspiration of blood from the pouch of Douglas. So aspiration of blood from the pouch of Douglas is done, and blood does not clot, which is also an indicator that there is ectopic pregnancy. So blood tests can also be done, apart from that, can also be done in order to determine the levels of HCG and progesterone, because these hormones are present during pregnancy. And if the levels of these hormones start to decrease, or they stay the same over the course of few days, then ectopic pregnancy can actually be suspected. Then blood for grouping and cross match is also done for redness of transfusion, because in ruptured pregnancy, there is extensive hemorrhage. Transvaginal ultrasound will also be done, and this will actually show that the person is pregnant, but they can't see anything in the uterus, because the implantation is not in the uterus, but it's in the fallopian tube or other site of implantation. Scan can be done as well, and it's going to review the defects. So when it comes to treatment, especially if in a situation whereby the patient has ectopic pregnancy but it's not ruptured, they can be able to give methotrexate. So this is the main drug that is actually administered, especially if it's unruptured ectopic pregnancy. So methotrexate is a drug that stops the growth of rapid dividing cells, such as the cells of the ectopic mass. So it stops, it like limits the further growth of the embryo, because we don't want the embryo to grow, because in that place where it is not conducive for it to grow. It's not made, its development is not made for that place. So this drug is going to make the embryo, it's going to stop the embryo from growing. So when this drug, when this drug is effective, the medication will cause symptoms that are similar to miscarriage, and that is the cramping, bleeding, and passage of tissue. Those are some of the side effects of this drug. So once this drug is given, this is what is going to happen. It is going to limit the growth, or it's going to stop the growth of the embryo so that it does not develop any further. And then passage of tissue can be a passage of tissue, bleeding, cramping can be that will actually indicate the effectiveness of this drug. Then in a case whereby maybe there's a rupture of this ectopic pregnancy, that's an emergent condition. So this patient is actually going to go into surgery, and laparotomy is actually going to be done. And laparotomy is the removal of the embryo and repairing of any of the internal internal damage of these pelvic of these internal reproductive organs. So laparotomy is actually going to be done surgery in a case whereby the patient comes in with ruptured ectopic pregnancy. So there'll be resuscitation, and then now you prepare the patient for surgery, and the surgery will be done. The surgery will be done in order to remove the embryo. And then if you find that the fallopian tube has actually been damaged because of the same procedures, you find that the fallopian tube can also be removed together with the embryo, and the removal of the fallopian tube is actually known as salpingectomy. So those is some of the treatment or the management of this condition, medically and surgically as well. So even if it hasn't ruptured, you find that the person can still go into surgery so that they can remove the embryo, And then if the fallopian tube hasn't undergone extensive damage, it can just be left there. But if it has been damaged, then it can also be moved together with the embryo. So that is on management. So you can either prepare the patient, imagine for preoperative management, you putting in mind that it's an emergent condition, so you prepare them for an emergency preoperative management. Or you can ask a question to how you're going to manage this patient post-operatively. So those are the things that we'll look into further on, not today. So we just wanted to concentrate on the basic or the whole, what is really happening around the ectopic pregnancy condition. And then you can also explain one of the things that I would love to highlight are the information, education, communication, IEC points that you can give to this patient before discharge. So explanation of ectopic pregnancies with aid of the diagram or chart and the site where she had the ectopic pregnancy and the type of surgery so the patient complies with the management. You also state the signs and symptoms so the patient can recognize an ectopic pregnancy early in a case whereby she faces the same situation. And then the predisposing factors to ectopic pregnancy and possible prevention, e.g. sexual, one of the predisposing factors can be sexual transmitted diseases, so the person can be aware. Family planning up to 2 years to allow so the patient will be on family planning for up to 2 years to allow recuperation or healing of the internal reproductive organs. And then use of intrauterine device to be allowed only by the gynecologist, because we need experts to work on that. And then the possibility of conceiving from the other fallopian tube in case of salpingectomy, which is the removal of the fallopian tube, was done. So you also explain that there is a possibility of in a case where salpingectomy was done, you also highlight on the possibility of them conceiving again. Patient is advised on the importance of a balanced diet rich in protein and vitamins to promote wound healing as well as to boost the immune system. Patient is advised to avoid strenuous work and lifting heavy things, as this may lead to gapping of the wound. Patient is advised to exercise, or literally they are advised to ambulate in order to prevent deep vein thrombosis. The patient is advised to be on family planning. I've already mentioned this. The patient is advised on the importance of going for review, as this is vital to monitor her progress and to adhere to prescribed drugs. So it's not he or she, just actually she is advised to be going for review so that their progress of their condition can actually be monitored. And then the patient is also advised to observe for danger signs like past discharge from the wound, gapping of the wound, and fever, and go to the hospital as soon as possible, as this could mean the presence of infection. So that's it on today's session on ectopic pregnancy. I hope this information actually helped you. I hope even as you come across questions concerning ectopic pregnancy, be able to use this knowledge to proper manage that condition. So thank you so much for sticking around today's lesson. Hopefully you'll still be with me in the next session. So thank you for today. Bye bye.